So what are we doing, or is there protocols in place on how we deal with the HIPAA violation? Because, let me just tell you about this case. And Mayor, I emailed your office and you asked me to work with Maurice, which I have been, because I have two people in my community who are reaching out to me who are very sick, have been sick for 2 weeks now, and has not been seen or tested for that virus. So when they did call, they went to urgent care, tested negative for the flu and strep, which was great because one of them has an autoimmune, some type of problems with it, whether it's a deficiency or whatever, I don't know. This is things she shared, and I asked if I could share this story but not use her name. And she was saying, yes, please, they're begging. I'm messaging her throughout the day, yesterday, today already again. I mean, she's getting desperate. She just this morning called Lieutenant Governor's office to say, help me. Because when she went to urgent care, they sent her home. She was seen on March 1st at Hilo Medical Center, where she was not tested for the flu or coronavirus, she says, nor were any precautions taken at that time. I guess they were still working on it. She said she called her primary care physician on Monday per Talmadge's advice, because she spoke with Talmadge on the hotline, which is great. We have that hotline. I love that we have all these things in place, but they're still falling through the cracks. So we're somehow some communication with Department of Health, and that's why I'm saying the physician or whatever, we're dealing with some HIPAA laws as well. So and I'll finish and then I'll let you address this. Then her primary doctor turned her down and said, no, we cannot see you because you sound like, you're too sick maybe. But she said that they would turn all her records over to Department of Health and asked her to stay home and cancel everything she had scheduled. She called Department of Health that day and did not hear from them till this very day. So nobody's calling her, right? So then she's panicking because they're sick, and they've been sick for 2 weeks. And she said, she called Department of Health, and they did not hear from anyone and all. And so today, like I said, she called Lieutenant Governor's office, and she's hoping that somebody can reach out to her. When I talked with Maurice, I have her number, but people are afraid of calling her to talk to her because afraid of a HIPAA violation, which I don't see as a HIPAA violation because they called in our hotline. So I would think our hotline can follow up and say, hey, did this get addressed? So I know we have wonderful things we're setting up and in place, but if we don't follow up, they're falling through the cracks. And right now I have two people so far reaching out to me that are panicking right now. And I don't blame them because we don't know how fast this virus can take effect on their body, and especially if she's saying she has some immune deficiencies or complications. So how can we follow up with this, Mayor?
No matter how complete we are, there will always be cracks. That's nature of everything, of people, communication. But the policy is this. First of all, until yesterday, the testing procedures for this nationwide, and maybe a little more Hawaii because we're such an isolated island, have been brought to the attention of CDC, who is the main coordinator of that, of approval, et cetera, that Hawaii we had to wait approximately a week because we had to send a sample there initially and then to come back. And that has been greatly improved by CDC, where just yesterday an announcement was made that the private companies of diagnostic and clinical will have the ability. So that will greatly cut down time and those factors. In regards to those kind of cases of the policy up to this point, and I don't know how it would be adjusted, but hopefully it'll be much, much better. There only were a person, and look side-eyeing the chief here and Department of Health, Eric, if I say anything wrong, please just raise your hand and hit me on the head. But, the policy has been the doctor is the one that makes the recommendation whether a person should or should not be tested because it was such a limited number that could be tested and we couldn't overflow. And when you have that kind of human judgment and change of person's conditions hour to hour, day to day, naturally that, can cause mix-ups and, again, gaps. So, again, that's the policy till now, until I think it will be changed, that a medical doctor is what makes the determination whether it warrants testing or not.
And so that making sure that our physicians throughout our island is educated about that. That's part of your educational program.
Yeah, that's absolutely correct. And that is something that when we run through the scenario in our training, we're going to have questions about, if I'm sick, what do I do? And if we're telling them in our training to contact your personal care physician or your PCP, then we all got to be on the same page when we do that. So we need to shore up that to make sure somebody doesn't fall to the cracks, and we'll do that. We don't want to overpromise and underdeliver that we'll have resources for everybody. I think the direction of where we're headed, we're going to have a lot more cases like that out there. So we need to shore that up.
Thank you.
Yeah, before I call on Mr. Kaniali Kleinfelder, I think what Ms. Poindexter brought up, I think the main thing is we gotta really protect our healthcare providers. We cannot just have guys willy-nilly going over. That's why I give credit to these two individuals. They're kind of staying put, and it kind of makes me think. And I don't want to cause hysteria or anything like that. But in as much as we haven't been testing people, I'll bet you there are a lot of people who had flu-like symptoms who were tested and were negative for the flu. But because we didn't have the testing equipment or protocols in place for COVID-19, it makes me very scared. I can almost, my intuition tells me that we have more than 2 people in the state of Hawaii who have COVID-19. And that's not to, make things crazy, but we are in for more rough times before it gets better. That's for sure. But before we even go further, I gotta say this to the administration. Mayor, you came here 1 month ago, right? Asked for an emergency meeting with the council. That was before any of the other counties did that. I wanted to give you credit for that. Look what has happened since that time. 1 month and a few days later. This thing is a pandemic. You look at businesses, Miley and I were at Hula Hula's last night. Like, just... Yeah, and having a few drinks. But... businesses are just being hurt. You were the first mayor in the state of Hawaii to declare an emergency, even 3 days before the governor did that, right? So I really appreciate you guys being on top of this. But at the same time, just listen to what people are saying because, we have to keep on evolving our protocols, right, with the needs. Okay, Mr. Daniel E. Kleinfelder.
Thank you, Chair. Clear communication equals less anxiety. If the desire is to calm everyone down, then inform us of what's happening. That's simple, that's easy, and I would just use that from here forward. If you want everyone to be calm, let us know what's happening. A good example, pictures of hazmat suit personnel spraying down parks, blowing up all over Facebook, and everyone asking questions on what is going on with cruise ships in the background. It's just a public desire to know what's happening. It's not political. It's not sensationalism. It's just keeping everyone informed of what's going on. And that way they can base their decision on facts and they can react accordingly. I think that's very important. I have a lot of questions. You've answered a few of them. Thank you. I'm glad we have a task force put together. My big questions are, as Aaron stated, we didn't have test kits. And that was an issue. And we couldn't get them for weeks. And we have FedEx overnight, and we can't get things back and forth. And we have technology. So I've been treating like this, like it's here already. That's what I've been doing with my family. And that's what I'm telling anyone who asks me. That's the best thing that you can do, is treat it like it's here. Protect yourself. Take care of yourself. Don't go crazy. Don't hoard. Just be prepared. Big questions that I see coming. If you're sick, is there coverage for you if you have to stay home? Because if you can't feed your family and you don't have money, then you're not going to go home to be sick. You're going to continue to try and work, and that is going to be most of the people on this island. Two would be the secondary, which is the businesses. What happens to the businesses after that? There will be no income for the business. So the employees won't have funds, then the business will not have funds. Those are two big questions that I see coming. And I'm not asking you to answer that now. I'm just saying those are things that I see coming. Three, all the keikis are going to go home. We have spring break coming. They're closing, like Italy has closed almost their entire country. You're seeing massive school closures. If that were to happen, then one, a lot of those kids rely on school lunches to make it through the day. So how are we taking care of our kids? And are we prepared for that? Yeah, and just I'm a dad. Yeah, I'm a dad. My wife is incredibly preparative. She went through Iniki. She survived, and she prepares like many other people's wives and families. And she's worried. So a lot of my questions come from on that side is my dad's side. And then there's a few questions that are out there that I would like to get an answer to is when the cruise ships come by, how far off of the coast do they dump their gray water, and where does it go? Yeah, a lot of members from Val's community were wondering about that, and that's a pretty valid question. Is that water being dumped close to our shores? Is it in our water? Is it in our sea life? And is it at our coastlines? And that is an interesting question. If you have an answer for that, I'd love to hear it.
First of all, Councilman, I assure you that your concerns are shared by a lot of people. I'm just talking one at a time. First of all, school closures.
Yep.
The plus and minuses before decisions are made. We convey into Oahu that families here to make up isolated areas always give Puna or Kau as good examples of the type of lifestyle they have. For example, which is a shock to most people when I say maybe half, maybe more, maybe less of the people in Puna don't even have running water and that kind of thing. So what percent of the families in Kau or Puna or elsewhere qualify for free lunches and breakfasts? And how shockingly surprising, I'll take Kau, where over 90% of the families qualify. That's unbelievable to many in the urban areas. I just need you to know that before decisions are made, we will make sure we make our input. A lot of that schools obviously is run by the state, but the consequence of it is generally the county.
Yep.
And that will need to be discussed and addressed. In regards to the cruise ships, yesterday I met with cruise ships, but I didn't ask that question. But I don't know if anybody in the audience know that, but those are obviously not controlled by county. And does anybody know the answer to the question, how far offshore they are allowed to dump? I'll find out for you.
Thank you.
In regards to the other, other things of economy, I think I've told enough people to realize that this is way beyond the disease. This is the consequence of every action we take and what is happening. I'm talking to the cabinet this morning and other people of the work group, of the already people suffering because business is down, especially certain service. And they know I've told them how lucky we are. By we, I meant government workers. because our paycheck is not based on something so fragile as not enough customers for the day. So I appreciate you mentioning those things. I'm not trying to be insultive here, so please don't interpret it as such. But it's really nice to see such caring. And that is because you thought about those things. So know that it's shared. Your question that I could not answer, I'll find out and get it back to you. But I think those rules and regulations of the waste product is, controlled by EPA, and hopefully they'll take into account this kind of things. And with that, if I may, Mr. Chairman, I did say the World Health Organization has classified this as a pandemic, and I think I need a time to very briefly, explain what World Health, what they mean by that, because the worst thing they say is for us to create fear, and as the chief so, well said, one of our missions is to make sure that we do add to panic and fear. And I'll read what the director of the World Health said this morning. Pandemic is not a word to use lightly or carelessly, the director said. It is a word that, if misused, can cause unreasonable fear or unjustified acceptance that the fight is over, leading to unnecessary suffering and even death. The World Health Organization considers a pandemic the worldwide spread of a new disease for which most people do not have immunity. Secondly, Centers for Disease Control and Prevention said pandemic diseases are new global viruses able to easily infect people and spread from person to person. And that's why they classify it as a pandemic situation. It is new, and it is worldwide. And at this time, because of its newness, we don't have a vaccine. So all the actions we're going to take is try to minimize, as the chief so well said, especially of fear, has to be based, as you said, on good information. And we know that credible and good and timely information is one of the greatest elements of battling fear. And we must do a better job on that. In regards to what happened, of that, the parks people immediately going out there and spraying, and that's my fault, the responsibility on the timing of that and the lack of notifying people. We were notified in the afternoon of the possibility of affected people visiting our shores of the east side, finding out different places they commonly go. Immediately public works would say, do what you can as fast as you can, even though it's Pahan almost, to go out there and do some disinfecting. How effective it will be, nobody knows, and I don't care. Just do what you can. And from now on, when we do things like that, I'll make sure that on SOP it is notification of what we're doing.
Thank you. I think just letting people know what's happening, and people are smart. They can make a decision. How we balance economy and health. They're interrelated, but at some point it's going to have to be public health over the economy, and that's I think that's really what we're looking at. And just to sum up things that I've seen, people I've talked to, that's going to be a very hard decision to make. I do not envy you, but
one of the things I read, your county government is now evaluating all activities under its authority, whether it should be held, and if it is to be held, under what conditions. And as you know, if it was as simple as just somebody having fun, it's an easy decision. Well, we know our responsibility also, and that is impact, and especially of this one, economic impact. Economic impact obviously means lifestyle of survival, not just the disease. And I know we've already met with Mary Monarch people to discuss it. We know we should make decision on that one particular thing. Hate to pick on one thing, but it's obvious what we're talking about. That we have to make it as fast as possible, because the longer we wait, the more inconvenient it gets. And we do get stories, and actual stories of people who spend a whole year making things to sell, and that's their livelihood for the year, et cetera, et cetera. So I just need the public to know and you to know that we're discussing it. We're trying to see if there's any way, first of all, as I said, that if the decision is to make it, can we make it with acceptable risk? All of that will be done on a case by case. And on this particular case, must be done decision anyway as soon as possible.
You know, notwithstanding that the World Health Organization has deemed it a pandemic recently, I think we all knew intuitively again that this was going to become a pandemic, right? I mean, in as much as it was, you know, coming out of China, right, the most populous country in the world. It was from some place like the Seychelles or something. I don't even know why I picked that, but, you know, then not too bad, right? But, and, you know, because of travel, right? And that's why I think a lot of people are kind of apprehensive, because I don't want to, you know, criticize anybody, but the state, I think, and no offense to Eric over there, because, you know, he's a line operator, but, you know, because this is coming from the top, but I think they could have done a better job, you know, in my opinion, from the get-go. Because we are a hub. Yeah. And I think really those who were in charge, not only here, but in different places in the United States, didn't really foresee how big this was going to become. I mean, as long as you have travel, it's going to become a problem. So a pandemic, foregone conclusion. It's how bad this pandemic is going to be. That is the question, right? And, you know, we can only do what we can do. Mayor, what is within your authority and what is within the governor's authority? I mean, can you explain to us what you do and what he does in all of this? Because I'm just thinking they're going to call the shots because they have the Department of Health, right? But you guys are only involved with the logistics on the ground, or what's going on?
I shouldn't, you know, I will not expand on it, but I think people know of my impatience with the state and federal government. Mm-hmm. I've said it openly, especially on the testing, and your examples of the time is, you know, really bothersome that we had to rely on a plane carrying a sample there and a plane, you know, result back, and the first kit that came here was broken or not functioning right, so you got to send them back. And, you know, that is so ridiculous to me in this day and age. And then finally, yesterday or today, the private labs are going to be given the equipment and training to do it. To me, it should have been done 2 months ago or whatever. You know, it's all that easy for me because I'm Monday night quarterbacking. But on your direct question of how much, I do everything I can do until somebody tells me it's not my authority.
Okay.
It's as simple as that.
I understand Harvard and Columbia closed school, right? Japan, at least 2 to 3 weeks ago, public schools closed, I think 31 million kids. I know you've closed schools before, you know, in the past. If it gets to that point, who would make the call?
Under the state, if it's under state government, under proclamation, everything is under the governor's control,
Okay.
including our activities. Once he did declare, automatically the schools, you know, is one of them.
Chief Ochita, I'm concerned about supplies, the PPE, the N95 masks, and I ask because partner's a firefighter, and I see him as first line of defense in having to pick up people that are potentially infected and bringing them to the hospital. So just wondering if you could weigh in on the level of supplies that we have, because we're an island and everything we have, mostly everything, is imported. So how confident are you in our supply stock?
Currently, our stock is good. The concern, like you brought up, is the resupplying. So we've had back orders on supplies for weeks now. We put in orders from the beginning when we were in tune with what's going on, and kind of like the theme of staying proactive. However, because it's a worldwide issue, an international issue, it is something that we have on our radar. So we're monitoring our levels of PPE. We're monitoring the vendors and the turnaround time. In regards specifically to N95, we have a good stock of N95s with our department. The mayor has just informed me he has some supplies as well. So N95-wise, I think we're in a good position. It's the other PPEs, like the gowns, that every first responder, every healthcare provider is battling to get, so to speak.
I'm a fan of plans. You know, keep calm, plan on. I mean, just plans keep everybody focused on the same page, and I like that. I just like knowing what plans are. And so I wonder, are we starting from scratch, or are we taking a look at the pandemic influenza operations plan that was prepared for our county in 2010?
We are reviewing those plans, as well as the recent dengue outbreak. That was another one. Granted, it wasn't spread person to person, but there are templates in that we're looking at that we did for outreach, for prevention, for training. So yes.
And also how to coordinate multiple stakeholders, because we're realizing this is not just a Hawaii County thing. There's a ripple effect that's happening throughout our community, so everybody needs to know what role they play and how they can support. I'm wondering if another target audience we want to look at is individuals with obesity, because in articles on individuals who have lived through COVID-19, there's serious impacts to respiratory systems. And so I just want to make sure that we are doing proper outreach and helping our communities be as strong and resilient as possible. I'm not a health expert, but I just feel like this is a target population that we have high rates of here in Hawaii, so I want to make sure that outreach is targeted to them and their specific needs. I've always taken this very seriously, and then there was a podcast with Joe Rogan. He had Michael Osterholm on, who is an infectious disease expert, who in 2005 predicted this, and it's a very sobering podcast. I'll send you the link. I'll send everybody the link. I was very concerned, but now I just feel there are going to be catastrophic consequences to our community and our economy. And I'm not saying it lightly. And I just want to make sure that we are building the resiliency we need to withstand the impact of COVID-19. Like we saw with recovery, everyone here is juggling multiple things, day job, but also our response to this. Not pointing fingers, not blaming. I see there's a lot of work being done to be proactive, but I just want the community to be rest assured that, like Mayor said, there's some level of normalcy that we're going to be expecting programs and services. And so just curious about whether or not each department has continuity of operations plans.
I think all of us are in the planning mechanism of, not just because of this, your operations must continue. How we must establish priority if it comes to the point where certain things need to be shut down, but still continue their priority missions. And I assure you we are doing that.
You know, Aaron alluded to school closures. I've had constituents call concerned about the virus and are wondering, can they just keep their kids home from school? Are we talking with DOE about some kind of teleeducation? I don't know. And that's going to be hard for a district like Puna, where there isn't a lot of connectivity throughout the community. So not expecting an answer, but I'm hoping that DOE is going to be coming out with something so that we can just assure parents that there is a plan of action, that their kids still can participate in education in a safe way. The final thing I'll ask is about our budget. You know, yesterday, maybe the day before, economists came out and they talked about this 10% decline in our economy, and we are so reliant on tourism. And if folks don't come here, there's less work for folks to do. And just the ripple effect it will have is extremely concerning. And so I wonder if we've gotten the first draft of the budget if the second iteration is going to reflect how we are considering the impact of coronavirus. I mean, yesterday in committee, we discussed infrastructure projects and bond floats because we were leveraging GET. But if less folks are coming to our island to visit, and the statistic was visitors will pay for 40% of that GET bucket, there's grave concern about our ability to be able to afford these things.
I'll make it clear here. During all emergency, normalcy stops. And some of it predictable, others are not. Shortage of revenue is an automatic thing. Adjustment that we may have to come forth to you and anybody else or departmental is going to be automatically done and must be done. The BEDT already has estimated in regards to possible shortage on minor kind of flow stops. So I'm just notifying you that yes, our total budget will be adjusted. Right now we're planning as is, and then we'll see what changes have to be made, and it will be made. I need all of us to understand that this is, something that none of us have any control except here. I think you've heard what I said we all have to do to minimize it, the impact. But things that outside of here that affects us, because as you said, we're a hub, we're in the center of the Pacific Ocean. Things that affect us. I learned a lot of sacrifice, for example, like Italy. I really admire some leaders today. Can you imagine being in charge of a country and quarantine that country from the rest of the world? Italy depends heavily on tourism also. But we all must put lives and survival and normalcy of that element as number one, bar none. And I ask you to trust that we will do that, constantly weighing what must be expanded or cut or whatever. I appreciate your words, sir, on what we have been doing. I just told him this morning appreciation of him as a person, of the wisdom of selecting him to be head of the very difficult task force, and I watch him work and the rest work. We will do everything we can and think of and communicate with you better and everything else in regards to have this community ride it through. I kind of like to emphasize this, though, because I think the tone of everything is so negative that I've added to anxiety or fear more than I should have. The good news about this virus is the following. It is estimated at this time that this is a new virus, obviously. Number two, 80% or more of the people that get affected by this virus will survive this virus and not even know they had the virus, because their symptoms will be minor in regards to sniffles and light cough and those kind of things, low fever. It is known at this time that the majority of the severely affected is that their system, not the immune system, but their system as a whole is weak anyway because of age and other health conditions. My son called me up because my granddaughter heard that 80-year-olds are the most greatly affected, and she says, "It's Grandpa." That's Grandpa, and I know that. And I hope the 80-year-olds don't misunderstand what I'm saying. I think we all 80-year-olds are glad it's the 80-year-olds and not the 2-year-olds.
Yeah.
So the good part about it is that the vast majority of those who carry the virus will not even know they had it unless they are tested for it. And I considered when I heard that a very good news. They say the mortality rate is in the 3% range, and that's high. There's many times higher than a normal flu. But if you compare all of the figures, that's low in regards to the young age people. We will address this, and I thank you for your words and us being proactive, because I really believe we are more proactive than most anybody.
Yeah, I really do believe that too.
And we will do more. I got great people around me. Let me read what it said. Oh, answering your question, sir. Disinfected sewage can be discharged 3 nautical miles from land. Not disinfected, 12 nautical miles from nearest land. Maybe that's not far enough.
Well, Mayor,
I hope people look at it.
I wanted to talk first about that N95 because we're in education mode. The mask. N95 is only good if you are infected.
That's what I heard.
And you're protecting others from getting infected, or does it guard you from infection as well? I've been told it's just only good if you have the infection.
What the CDC is recommending is that, if you're healthy, you shouldn't be wearing a mask. And yeah, you're right. Where if I had symptoms, flu-like symptoms, and I wanted to protect from spreading the virus, then I would wear a mask if I was sick.
Right. So it's more for protecting others then. I was so proud, and not to make light of the situation, but, I got like 3 boxes of the N95, right? I gave one away because somebody was going on a cruise of all places, yeah. So, so I proudly told my wife, and she's the resident COVID-19 expert in our household, right? And so she goes, well, what size is it? I go, size? I didn't know there was any size to this thing, right? But there must be sizes, right? Because if you don't have the right size and you don't get the proper education in how to put that thing on, it's nothing, right? So, I mean, that is an educational tidbit that should go out there too. Because I know there's a run on these N95 masks, So you got to have the right size and you got to know how to properly apply it.